All right. Well, CBS News is telling us that heart attacks are increasing in young adults at an alarming rate. They found a contributor who was willing to sort of shrug her shoulders and say it may have to do with lack of vaccination, even though we've never seen really conclusive evidence that COVID is related to heart events. But we do have some data showing that vaccination is related to heart events. And so they don't even ask the question. It's amazing footwork to see how they really dance all around it and never even ask. So I'm going to play you this segment, and then you can pick your jaw up off the floor for the sort of clown world journalism that this is.
Heart attack deaths have become more common across all age groups since the start of the coronavirus pandemic.
But a recent study found that young people are actually most at risk in this case. According to Cedars-Sinai Hospital, the number of heart attack deaths among 25 to 44-year-olds in the U.S. over the first 2 years of the pandemic was 30% higher than predicted. Dr. Celine Gounder is here on set with us to talk more about it. She's editor-at-large for public health at Kaiser Health News, and she is also an infectious disease specialist and epidemiologist and a CBS News medical contributor. Dr. Gounder, thank you for being here. What stood out to you in this study?
I think the fact that you're seeing such a big increase specifically in the youngest age group, so the 25 to 44-year-olds, you saw this 30% increase in the risk of death from heart attack. And that really is quite striking. That's not a group, an age group in which you normally see heart attacks, much less dying from a heart attack.
So to do a study like this, you look at the years prior to the pandemic and the typical rate of heart attack death in that age group, and then you see it increase, and you wonder what's the new variable. And so the pandemic is that new variable?
That's right. So these researchers looked at 10 years of data across the U.S., all the death certificates that get filed with the CDC, that data. And so what they saw is prior to the pandemic, heart attack deaths were actually dropping. And then that trend reverses, and you see those deaths go up, especially among that youngest age group during the pandemic.
And do we know why why younger people might be more at risk, or?
We don't know for sure. And in fact, these death certificates are probably not even capturing the fact that they might have had COVID. They're really just saying, did you die from a heart attack or not? What we do know, however, is that younger people were less likely to protect themselves against COVID than older people, less likely to mask, less likely to take other mitigation measures. And they were also farther back in line to get vaccinated. So they were not protected with vaccination until later in the pandemic. Those might have been a factor here.
So basically, I mean, you could have had perhaps a mild infection, and of course, this is all hypothetical, but then there might have been a lingering heart situation, heart disease.
Right. So COVID causes inflammation of the blood vessels as well as other parts of the body, and also blood clots. And what we think is that a COVID infection may have actually accelerated the process of developing heart disease, what we call coronary artery disease, and so therefore accelerated when somebody might have had a heart attack and died from a heart attack.
You know, but COVID also changes how much you can get out to an exercise class, how often you see friends, maybe your level of activity overall, your stress, whether you see your doctor.
To the doctor.
How are they ruling out or accounting for these other lifestyle changes?
We don't know. So you can't really assess that just from looking at death certificates. Again, all we can say is how old were they? Did they die from a heart attack? But, you know, some of the factors you're mentioning could certainly have played a role. We also know healthcare facilities were really overwhelmed during the pandemic. So was it that somebody had a heart attack and then was less likely to survive because the healthcare facility was overwhelmed?
Couldn't get there on time. Well, thank you so much. Something new to go and see your doctor and check yourself about.
All right.
Thank you.
So they had 3 minutes, which is a long time in TV news. And they managed to ask her about whether or not this is because people didn't go to exercise classes or lifestyle changes or didn't get a checkup.
Or didn't get to the hospital on time. It's their fault.
They never
You didn't get there
ask.
fast enough.
They never say, could this be related to vaccine rollouts?
Right.
Which is a fair and obvious, painfully obvious question. And she doesn't bring it up, and they decide to ask all kinds of unrelated things about young people having heart attacks.
I mean, the data we've featured here on the show has been overwhelming about this issue, right? So we've featured that data plenty of times. We've had Dr. Asim Mayorta on the show. We've had Dr. Peter McCullough lay out these, Dr. Robert Malone. We've had Jennifer Smith. The end of list of doctors that we've had on this show, highly revered doctors, and they make no mention of it whatsoever.
Right. Someone in the chat just pointed out children should be going to exercise classes so they don't have heart attacks. What?
Well, and I've seen several articles. They've been trying to connect the adverse reactions like the blood clots, because you notice she said the blood clots. They're talking about the myocarditis. They're not saying it. She didn't actually say that word, but they've been trying to connect that to COVID rather than the vaccines, even though there is no evidence for that whatsoever. Now, Dr. Mayorta and Peter McCullough did say you do with the virus get a mild case of myocarditis in some cases, but it's fully curable.
My favorite though was like that you just didn't get to the hospital fast enough. Like that's part of the problem here. It's your fault. You just did not get to the hospital fast enough.
Now, in a awful twist of irony, this same doctor who just gave us that, I don't know, could be inflammation or clots, and said nothing about a vaccine rollout, is the same doctor who is the widow of the reporter that died during the World Cup. Do you recall this person, Grant Wall, who died while in Qatar covering World Cup?
Isn't he the guy that showed up at the pride flag shirt, right? Wasn't there a big story about that?
Oh, I don't know if he's the
I don't know.
same
There was like
person.
3 reporters that died, so I don't know which one was which.
He's the one who, all of the tributes were during the games around him. And they said that he died of an aortic aneurysm. Here she is speaking to CBS about his death as his wife and as a doctor. Again, no mention of vaccine or vaccine status, none.
Can you tell us what was the exact cause of death?
Yeah, so he had an autopsy done here in New York by the New York City Medical Examiner's Office, and it showed that he had an aortic aneurysm that ruptured.
Which means what? Okay.
So aorta, that's the big blood vessel that comes out of your heart, sort of the trunk of all the blood vessels. And an aneurysm is a ballooning of the blood vessel wall, and so it's weak. And it's just one of these things that had been likely brewing for years, and for whatever reason, it happened at this point in time.
For whatever reason, she said, maybe it was there for years, even though,
And they
his
said
wife's a
natural
doctor.
causes, like the way that CBS said, natural causes. Okay. Really?
Oh, I guess he did have a rainbow shirt. I was not aware of this controversy.
Yeah.
And so,
That was-
okay.
yeah.
So, she said he must have had these heart issues we just didn't know about that must have been there for years. Meanwhile, the CDC does have this data. In the US now, codes have been added to the medical system that will show whether a patient is vaccinated or unvaccinated. Experts say they don't really like this because it treats unvaccinated people like a pre-existing condition, and they fear that it could be used to deny some services like organ donations. I just worry, though, if it's not being tracked, we wouldn't have data like this. So, in fact, the CDC started using these vax versus unvaxxed codes in April of 2022. So we know which population of young people is experiencing heart attacks. We know that. It's just that no one's telling us. So there's the data. The media is fine to just sort of shrug its shoulders and be like, one of those things, like, people who explode on their lazy boys.
Right.
We don't know.
Well, and really quick, did you see the Damar Hamlin interview with Michael Strahan where he asked him, what did the doctor say specifically happened? And he said, I can't really get into that. Or he something to that effect. He couldn't say what it was.
Yeah.
And I think he's a little over that age group, but he's close.
No, in fact, I was just about to bring it up. Damar Hamlin, when he was asked about that with Michael Strahan in that interview, said, well, why? What happened? He said, I just can't talk about it. I just can't talk about it.
He said, I don't want to go too deep into that.
So move on. Like, I don't want to talk about it. Really? Okay. You literally raised millions. Suddenly you have millions of dollars that is given to your nonprofit, right? And you're not, and mysteriously you're not allowed to talk about something.
Yeah.
Okay. All right. Who's going to push him on it? I guess.
Anyway,
no one.
okay.
Yeah,
Well,
because
there's
lives
the
could
data.
be saved if he did say it.
Young
Right.
people have heart attacks, and we don't know. I don't know. Fish die in rivers. We don't know.
4-year-olds should exercise more, otherwise you can have a heart attack.
And get to the hospital quicker.
My 6-year-old little girl, Eve, I'm going to make sure that she runs on the treadmill before school every day.
Okay, she's got to do some jazzercise.
Like she'll be like, I can't, I'm so tired, Daddy, you can't do it. But hey, honey, it's for your own good so you don't have a heart attack, all right? 6-year-olds having heart attacks. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.